like the theme for this conference? Blood, sweat and ideas. So for the last 30 years I've been involved in healthcare, so during that time I've seen a lot of blood, a lot of sweat, a lot of other body fluids which probably didn't make the theme for various reasons. Not a lot of ideas. The challenge has been, even though in healthcare we have a lot of information and a lot of knowledge, delivering new ideas has been very hard. The one thing that drives ideas is often self-interest. So fairly recently I celebrated my 50th birthday. Having spent most of my life treating people over the age of 50, I can honestly tell you that getting old sucks. And there's a reason why getting old sucks. Click. And this graph shows it. When you hit 50, healthcare needs start to rise. And they actually rise for the next 40 years in a linear fashion. So basically from 50 onwards, you really start using the healthcare service more and more. Which, whilst I was a practicing doctor and charging for it, was a great thing. But unfortunately, the other challenge I face as a member of the baby boomer generation is that the population over the age of 65 in Australia over the next 20 years will double. Population over the age of 85 will quadruple. So just when I start needing healthcare services, there's a whole bunch of other people who also need those services. And I'm going to be working against those people to use those services. Now, the fact that the Australian population is ageing is not a bad thing. Think about what the alternative to ageing is. It's basically dying. So we want to try and avoid that. And as you look at the Australian history, Australia has one of the longest lifespan or longevities in the world. So what that means is our healthcare system, despite what you read in the paper every day and all the criticism you hear about it, is actually one of the best healthcare systems in the world. It's done a very good job in making us live longer. But as we go forward, the challenges it faces are rising because of the ageing population. We need to understand how we manage that. As with every other industry, health has used computers to try and scale up. We've even developed a brand new word for that, e-health. Now, I have to be really honest, I hate the word e-health because e-health is a combination of two very vague terms. E for electronic. Could be a computer, could be a toaster, could be anything. It's something with power in it. And health. Well, health, if you look at the WHO definition, is a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. Sounds good, but in actual fact, that's an ideal state. That's where you want to be. But it's not an action. So telling people where you want to be without defining an action is really hard. Healthcare is the action. What our healthcare providers do is the action. So I prefer the concept of care. And care is the work of providing treatment for or attending to someone or something. It's what healthcare providers do. It's what parents do with their children. Care is what makes a difference. If you look at the 80-year-old with heart failure, it is the care provided by their care team who manages their medication, their diet, their physical activity, which stops them basically drowning in their own bodily fluids. If you look at the 75-year-old who's been smoking for 40 years and has a lung capacity of 10%, it is the care provided by their doctor in managing their antibiotics and their prednisolone and the various drugs that stops them from getting that small infection in the middle of winter and not being able to breathe. If you look at the 20-year-old young schizophrenic boy who is being managed in the community, it is the care provided by his care team which makes sure that he doesn't do harm to himself. The 28-year-old first-time mother who is suffering postnatal depression, unless she's provided with care, we don't actually have a solution. Care is not a new idea. Hippocrates wrote about care in the Hippocratic Oath over 2,000 years ago. The concept of care is basic to the delivery of healthcare services. But the problem we face is that 2,500 years ago, Hippocrates could provide this care on a one-on-one basis to all of his patients. He could walk around the agora in ancient Athens and treat people and spend time with them. But the statistics I showed you earlier show you that we cannot do that anymore. In the 21st century, we need to work out how we deliver care to a population which is radically increasing and without extra resources. How many of you have children who are enrolled in medical school or nursing school today. It's becoming harder and harder to find people to fill the places. So whilst in an ideal world, we would have more doctors, more nurses, people in remote places delivering care, we all recognise that that's not going to happen. So I'd like to introduce you to the concept of virtual care. And virtual care is all about delivering care when we can't physically be there ourselves. If you look at the photo, yes, that's me. There's a prize if anyone can work out who's up the top there, but I'll tell you after the event. The concept of virtual care is that we need a system which allows us to scale out our services. Provide the doctor, the nurse, the speech therapist, the physiotherapist, even more importantly, the community, the family, the friends, the caregivers, because even today, 75 to 80% of care in Australia is not delivered by healthcare professionals. It's delivered by caregivers, by family and friends. And then any of you who is a female between the age of 30 and 60, most of that burden will fall on you. We need to provide a model which enables us to do this and do this effectively. But we have to think differently. We have to think how we use the technology to do this properly. Because if all we do is take the current model and deliver it virtually, all we've managed to do is buy ourselves 5 years. Fairly recently, we've had the federal government funding the use of video consultations between doctors and patients. That sounds great, but all that does is allow us to currently scale out our resources a bit more. We need to start thinking how we use this technology differently to deliver a new service. When it comes to looking at our elderly, we need to understand that the old African proverb, it takes a village to raise a child, is now circumvented by the fact that we actually need a virtual village to help care for our elders. Our elders are the new children of our generation. They will require a lot more care than we've currently been able to deliver. So I'd like you to think about the fact that the virtual village is how we care for our elders. The concept of how we change healthcare is not new. This is an editorial in a January 2010 edition of the New England Journal of Medicine. It's written by Don Berwick. Don Berwick is the chair of the Central of Medicare Services in the US, and is a well-known luminary. And he talks about how other industries have done things differently, including taking advantage of technology. But in healthcare, they haven't. And there are many reasons why this is so. Healthcare professionals are very resistant to change, because the change required to do this requires them to have new ideas. And the challenge they face in having new ideas is that when you are swamped looking after your day-to-day proceedings, it's really hard to start thinking of new ideas. But amongst the many ideas he had up there, which are common across most industries, measuring performance, using technology to automate, one thing that didn't come up is self-service. And as we start going forward, self-service, or in our case, self-care, is a critical part of healthcare delivery we need to understand. How we shift the model of care from not just relying on the doctor and the care team, but the patient being put in a position where they can deliver part of the healthcare service themselves. The only person or part of the system we can scale out is the individuals themselves. And let's be honest, if you have a health condition, you are much more likely to be concerned about it than anyone else. How do we drive self-care? And how do we use technology to make this better? Well, it's pretty straightforward. We've all seen the growth of information on the internet. We've seen the huge amounts of information that's currently available to anyone at the click of a mouse or the press of a button. What we need to do is provide that same information base in a way that's relevant to patients. Provide them with tools which enable them to play a more active role in their own healthcare. So what does that mean? I mean, we've all seen posters around which tell us to stop smoking, exercise more, very generic concepts around healthcare, which don't mean a lot to a person who's sick that day. We need to be able to provide that information in context, relevant to the person, in a way they can use. And the people who need it now and over the next 2 decades are not the tech-savvy iPhone users that are sitting in this room. It's our parents and our grandparents who have never actually had access to computing. So this idea that we can give them a website and that will solve their problem doesn't work. Trust me, we've tried it, it doesn't work. You need to start looking at providing it in a context which is relevant to them. Easy to use small bites of information. To get there, you need to engage with them. You need to get them to understand why we are doing this. This is not about social isolation. This is not about pushing away elderly people and using the computer to avoid us visiting with them. We will still need to have social interaction. We still need to spend time with people. However, we don't need to limit ourselves to only spending time with our grandparents to talk about their medication. We don't only need to send them visitors to measure their blood pressure. That's the sort of stuff the gadgets can do. We can replace that with real human interaction. We need to educate them. We need them to understand their condition and the relevance of the various things they're doing. You know, the blue tablet is no longer enough. You need to understand what the blue tablet does, and the best time to educate them about the blue tablet is when they're taking the blue tablet. Not the printed sheet that they get when they pick it up from their pharmacy. Not the DVD. And when I was working in the medical field, we used to send diabetics a DVD about diabetes. Probably was the most enthralling watching. I can just imagine all families sitting around the DVD player watching the story of diabetes. It doesn't happen. It's about providing information in context. We educate them, but we use real educational notions of how we do it. And finally, we empower them. We make them the leader of their care team. We make them the ones who decide what's going to happen. Give them the tools and they will do it. But if we don't do it correctly, if all we do is have a very light-hearted education process where there's a bunch of brochures in the library, go and read about it, we're not going to get anywhere. So let's summarise. What are we up to? We're about to face a huge challenge in our healthcare system. Those of us over the age of 50 will basically become a burden on those under the age of 50. We need to make sure that system scales up in such a way that we can make sure we have services delivered to us. We need to take advantage of technology the way technology can be used. Stop thinking about the old paradigm of good care and start developing a new mindset about delivering good care. Good care is not what Hippocrates defined 2,500 years ago. It was relevant to his time, it was relevant to his place. It's not relevant to us today. We need to provide the tools in such a way that people can use them, and we need to drive innovation. The biggest challenge we face to innovation in the healthcare system is that the way we pay for healthcare today is basically the same as the way we paid for healthcare 200 years ago. The way we deliver care is driven by the way it's paid for. If you pay doctors fee for service, one after the other, see as many patients as you can, and you'll get paid that way, then you will drive that behaviour. We need to change the way we think about the way we deliver healthcare and we pay for it. We need to think about the fact that our outcomes are important. The health of the individual, the health of the people we're looking after is the important thing here, not the financial system around it. If we do all that, if we get rid of the barriers in front of our way, open the doors so new clinicians can think about how they will use these technologies, how they will use these gadgets, how they will develop new models of care that are relevant to their patients, we have a chance. But if we stay in the current paradigm of a fee-for-service model based around volume, not value, we can't go forward. This is important. It's important to me because over the next 25 years, I'm going to be one of those double 65-year-olds. I need this system to start working. I ask you to look into that in the future. Thank you.